Well, hello there, health coaches. Before we get into today's topic of autoimmune disease, I know that a lot of coaches in our community are newer to coaching. Either, you just graduated from health coach school, or you maybe graduated a little while ago. We haven't quite gotten going yet. So that's why I'm hosting a free get together. I wanted to tell you about it today because it's coming up next week on February 16th. Be an opportunity to meet each other, to meet me, and chat about getting your business off the ground. So this is an entirely free event. You can register at healthcoachpower.com/getstarted2022. Now let's talk autoimmune disease. Now that we got that out of the way, for all you new coaches, whether you're new or you're more experienced, you may be thinking, can I work with a client that has autoimmune disease? Is that within my scope of practice? Do I know enough about it, right? It's a pretty specialized area. So last year in my own health coaching practice, and I want to remind you guys that I've been a health coach now for 13 years, and you can do a lot of good work with the basics. You really can. I know I have. But last year I did a special training to amp up my knowledge and my skills around working with autoimmune clients. And I took a course with Trescott and Angie from AIP Certified Coach. And I thought it was just so super well done. I've done so many different courses. I thought it was so tight, such a great program. These two have so much to offer. So I invited Mickey and Angie to join us today. Hello there, ladies.
Hey, thank you for having us.
Hi, Michelle. Thanks for having us.
I'm so glad that you could both make it. I thought with our schedules, what are the chances that everybody's going to be available? But we did it. So that's amazing. And I want to hear, just to kick us off, I mean, even when I look at your practices, oh, wow, look what they're doing. Holy moly. And certainly a newer coach looks and sees what you guys are doing with your practices. It's like, I'll never get there. So could you, maybe each one of you could just take us back and tell us what it looked like when you first started your health coaching practice, and how does that compare to now?
Sure, I'll get us started. I'm Mickey, by the way, and I started transitioning my career to health coaching after my own health crisis. So I'm sure a lot of people share this story. A lot of healers go through their own healing journey, and it really inspires them to want to help with other people and make it easier. And that was definitely my story. So I was diagnosed with Hashimoto's and celiac disease after what I thought was a long struggle. It turns out that a year is not actually that long in comparison to a lot of people's autoimmune journeys. But once I started to put the pieces together, find those answers, nutritional therapy and healing with food was a big part of my journey. And I had a prior background working as a personal chef. So I kind of combined those loves, went back to school for nutrition, and started practicing then, in addition to teaching people about food, including cooking. And that's what brings me here. And of course, Angie and I were brought together by Dr. Sarah Ballantyne, who was also going through her own health journey at the same time as Angie and I. We all met together and supported each other through our own journeys. And then out of that sprang AIP Certified Coach, once Angie and I had some history working with clients to lean upon and collaborate with Sarah on some scientific basis for what we now know as AIP.
All right. So back then when you first started, do you remember ever thinking, I don't think I'll ever be able to be a decent health coach? Like, did you have those doubts in the beginning?
I think so. Part of my illness was losing my job, which wasn't a great job, but it kind of ripped off that Band-Aid of like, is anything else out there possible for me? I think I had known for a while that the service industry was just not really working out for me, but I didn't have a way out. So illness was definitely my way out. And while I was sick and while I was working on my own recovery, I had a lot of time to think about what would make me happy and fulfilled. And so I think I was coming at starting my practice at a level of just like being fired up about what I had learned and what I had experienced that really fueled those early doubts, or I guess minimize those early doubts and fueled my passion for it. But I would say, 6 months in, did I make the right choice? Am I going to always have people calling to use my services. And I think the longer I did it, the more I realized just how many people need help and how few people are trained to actually support. So I know it can seem like there are a lot of health coaches out there. I definitely had that feeling when I was getting into it. I was like, I'm too late. And I mean, this was like 2013,
Yeah.
But the more I do this, the more I realize like we really need an army of nutrition professionals to help people with these pieces, because implementation of this stuff is actually really hard and coaching goes a long way. So yeah.
So you're pretty fired up, and yes, being unable to continue in the career that you're currently in. I know because I got laid off from my career in advertising right when I was thinking maybe of transitioning into health coaching. And then just like that, the Band-Aid gets ripped off and you're kind of like, here I am, let's do this thing. What an interesting story. So Angie, what about you? When you first started in your health coaching business, what was that like for you?
Yeah, I have a similar story in some ways to Mickey, in other ways a little different. I have 3 autoimmune diseases, lichen sclerosis, endometriosis, and celiac disease. Celiac disease was my final diagnosis, and it took about 11 years to get there. So I was really, really ill and very debilitated by that point. We were living overseas for my husband's career, and it meant we had to change our whole life trajectory so that I could come back to the United States and get medical help and find the right healthcare. And I'm sure lots of folks in your community relate to this. It turned out to not be very easy. It turned out that our medical system isn't really set up to help people with a chronic health condition like many autoimmune diseases. And so that got me looking for other answers. I found Sarah Ballantyne and Mickey, and that's when I made the decision to start transitioning my career towards helping other folks. I came from this background of mainly accounting, and I started the transition process into coaching, eventually went on to get a nutritional therapy certification as well. And then I started focusing on building group coaching programs pretty early on. And yeah, in the beginning, I thought I will be so lucky if I can keep this going for even a year. 8 years later, many thousands of group clients, a couple medical studies, it worked fine. And like Mickey said, there are so many millions of people in our country impacted by autoimmune disease, and we truly need an army.
We sure do. So, hey, for those of you that are here live, and I know we have a bunch of you watching right now, if you have any questions for Mickey or Angie as we go through today's interview, just pop them into the comments and I'll work them into the conversation the best I can. We've had people in the group interested in the AIP certified program. So anyway, fire away if you guys have questions. For Mickey or Angie, whoever wants to take this one, can you talk a little bit more about why the medical community just isn't cutting it? Because I see this huge opportunity with health coaches working with autoimmune clients, more so than with other types of diagnoses and illnesses. Can you talk more about like why the medical establishment is not suitable for actually helping with just about anything when it comes to autoimmunity?
I'm happy to jump in here, Mickey, but you can certainly add if I don't cover all the bases. I mean, I think the truth is that our medical community definitely plays an important role. Mickey and I do not take a dogmatic approach that you should only have, natural dietary and lifestyle methods over any conventional medical approaches. Autoimmune diseases are really complex, and complex problems we need nuanced solutions to resolve them. So that might mean combining. But traditionally, the medical path alone doesn't seem to work with a lot of folks. And I think it's because our system is mostly focused on how to resolve acute problems. So like if you have a heart attack, our system is great for you. But if you have celiac disease, our system might not work as well. And that's where health coaches come in. I feel like we can be the bridge between what the doctor's office is saying and the person's real life. We can help them actually implement things that they can do on their own that are more likely to help over a long haul with a chronic disease.
Do you want to add anything to that, Mickey?
Yeah, I think just what I would add is that our medical system isn't really incentivized to help people with chronic illness. I think it goes all the way down to our society doesn't know how to deal with people who have chronic illness, friends, family support level, and then in the medical level, there just really aren't a lot of incentives for people getting well. And autoimmune diseases are very tricky. They are not curable. And so the medical profession, and also there's so many of them that they are seemingly rare when you look at them on an individual disease level, but with over 100 autoimmune diseases, you add all of that up, and the people that suffer from them and overlapping autoimmune diseases, it really is an epidemic that no one specialty is really well equipped to actually tackle, so I think that's a big part of it.
Yeah, that's what really jumped out at me. I had never thought about it before until going through your course about how there's no medical specialty for autoimmunity. So instead, someone's going to the endocrinologist or the rheumatologist or the whatever, bouncing around, but there's no one that kind of holds the whole picture of autoimmunity. And I thought, that's what we can do as health coaches. And I feel like I've had clients, even years and years ago, who said, no one's ever listened to my whole story and helped me put the pieces together. And it's so incredibly valuable when we can do that. So just to help someone not just think about, oh, it's my joints that are hurting, or, oh, I have this rash on my skin, but how could maybe this all be connected? That was very eye-opening when you guys pointed that out. So that is like the opportunity for all of you guys out there who maybe you've gone through an autoimmune disease yourself, you're going through it, or you've worked with a lot of clients, you have someone in your family who's going through autoimmune disease. I mean, it's very tricky. I think, is the average like 8 years for somebody to get a diagnosis? I feel like I've heard that.
Yeah, 8 years is about the normal journey with this stuff.
Yes, it's crazy pants. So I know that I've had really great results recently with my autoimmune clients, largely based on what I learned in your program. A lot of it is helping someone see that they might need to talk to their doctor because their symptoms are pointing towards possible autoimmune disease. Like they just never would have even thought it. No one's brought it up to them. Suddenly they're getting a proper diagnosis. Maybe there's some kind of medication, maybe there's not. And we're able to make such amazing progress so quickly, like within weeks. Some of my clients have been seeing really great results. So anyway, I haven't been sort of working in this genre for too long, but for you guys doing this for so many years, I thought maybe you could each share like your top or your most exciting client success story, someone going through, the AIP protocol.
I'm happy to start because I have a client that I'm just so fantastically happy for him. He was an older man who had a family and suffered from a long-term illness with multiple sclerosis, which you guys are probably very familiar with. It's a very debilitating autoimmune disease. There's a lot of very powerful drugs for it. And it is one autoimmune disease that very predictably has a negative impact on the ability to function and quality of life very early on in the disease. So a lot of the conventional treatment is really aggressive. And so this client came to me because he had implemented AIP on his own, but he was having trouble maintaining his weight and kind of working with some of the troubleshooting things about AIP. So he also had SIBO. And so we worked together to find a customized elimination, reintroduction, talked him through the management of the SIBO and the treatment with his doctor. And once we got out of those woods, it took about maybe 6 to 9 months. We stopped working together because he was feeling great and kind of had a plan going forward. And I didn't hear from him for a couple years. And he emailed me asking for a follow-up session. And I thought, oh no, maybe like some of his MS symptoms came back, thinking the worst. Because usually when we don't hear from clients, we assume they're off living their lives, doing great things. And he was like, oh no, actually, I just had a follow-up MRI. I have all full reversal, no lesions of MS in my brain. My neurologist is just so thrilled. But, I'm still having like a little bit of trouble. I lost 5 pounds. And I'm like, okay, great. Like, let's get back in there. Let's see how we can tailor this to help you keep your weight up. So he's definitely someone who stands out to me as someone who, it was just really fun to work with someone, who his motivation motivation was to be there for his kids, to see them grow up, to be able to play with them, because he was suffering from a lot of MS related fatigue, and to see that go away and for him to have that outcome was really fun.
Oh, that's so fun. And a lot of times, I mean, health coaching is such a female dominated industry. We forget to talk about our male clients. So I love that you brought up working with the male client. And so I want to ask, do you happen to notice any difference between working with men and women and bringing them through the protocol?
I mean, I have to say, in this specific client's case, one of the reasons why I think he was able to be so successful, especially long-term, he was on a pretty strict elimination, even when he had reintroduced a lot of foods, because of the potential severity of like MS is not something you just want to like reintroduce a bunch of foods and see, those patients are very motivated. He was able to maintain a high level of compliance because his wife was very supportive, and she had a lot of time, and she was a very good cook. And so I think acknowledging that piece, when people have support players in their life, it can obviously be someone's partner. If they're on board, they understand the reasons why they are undergoing these changes, and they're willing to put in some work to help them, it can really help them be successful.
Oh man, that is so great. And hats off to that wife, because it helps so much when there's someone else to share the cooking and the cleaning and everything else that goes into it. Just the
and
emotional.
I've had a lot of other clients who really struggle, because sometimes it isn't that their partner doesn't want to help, but maybe they're busy, or they're working, or they don't have the capacity. And even in some cases, the partner will sabotage. The partner will say, why are you doing this? There's no buy-in. They don't share the vision. And those are probably some of the most challenging situations, where people have no support, or they even have the opposite of support. They have some sabotage and some doubt within their own family.
That happens. We have a comment here from Patricia. She says, this is such overdue, relevant and needed content. And I agree. I mean, autoimmune disease is just, I'm sure you know off the top of your head better than I do. It's been going up at a crazy rate over the past 10, 20 years. Yes?
For sure. Incidence is definitely rising. And I think some of that has to do with diagnostics. I think a lot of people were probably previously suffering from autoimmune diseases and we didn't know what to call it. But I also think that our environment has changed a lot. What we have eaten is changing rapidly, and we're being exposed to all these different things. And unfortunately, our bodies manifest autoimmune disease a lot easier because of all of it.
For everyone who's with us live, tell us in the comments if you yourself have an autoimmune disease, if someone you love has an autoimmune disease, if you're working with any clients. I mean, just within this group, I feel like we all probably have connection to people who could benefit from the work that you guys do and the work that you're helping coaches to do. I mean, we hear about it all the time within the coaching community, because like you said, a lot of us got here because we weren't getting answers. We weren't able to heal from whatever was bothering us, and we found another way to do it. This is just so powerful. Anyway, Angie, tell us about one of your client successes.
Yeah, well, I have two stories. The first is very short, but I want to share it because I really want to encourage the coaches that sometimes very, very small and simple changes can have a very, very big impact for your clients. And you might think, oh, my knowledge is very limited. I'm not a doctor. I can't possibly help. But that's not true. One of my really big client successes was also a male. He had celiac disease, but one issue was that he was from a culture where they spent a lot of time drinking tea. And he was drinking like 8+ cups of black tea a day and no water. So he wanted to go through all this very advanced testing. He wanted to go to this really high-end clinic in a major city. And I convinced him that we should start with hydration and just work on hydration. And we resolved his histamine intolerance by working on hydration. So just so you know, the coaches out there know, sometimes it's really simple, low-hanging fruit that you can really bring to the attention of your clients and help them make really profound progress. One of my biggest success stories, though, is with a woman I worked with a few years ago. She had an autoimmune skin-related disorder called lichen planus. Lichen planus can not only affect the outer layer of the skin, but sometimes it affects the mouth, the gums. It can go even down into the throat. She had a very severe case that was just like that. She was herself an RN. She had been to like the Mayo Clinic. She had been to Cleveland Clinic. She had even done treatments that basically involved a form of chemotherapy to try to control the situation. It was causing difficulty for her to swallow. She had started having trouble eating because she was choking on her food. And it was just very uncomfortable. It was a very painful condition. And we started making changes, worked on the autoimmune protocol, helped her bring in a lot of nutrient density, especially like omega-3 fatty acids and other kinds of nutrients that support skin health and healing. And we made more progress that she had made in like 20 years prior with all those advanced treatments, being an RN herself and connected to her medical community. And when she went in for her checkup with her dermatologist, the dermatologist basically cried because they could not believe that she had finally made that kind of progress. So
that makes me have goosebumps.
Yeah. All these stories, even when, I mean, I know about the story that Mickey shared. I know about that client of hers, but every time I hear the story, it still gives me goosebumps and makes me so happy when I hear this stuff.
Gosh. Okay. So here's everyone saying about their autoimmune disease. Tara says she has multiple. Jennifer says she has Sjogren's and she plans to focus on women with autoimmunity in her coaching practice. Onelli's here. You guys know Onelli. She said your course was the best investment she made last year. Amy Jo says she has several autoimmune diagnoses. Diane is here. Diane also took the AIP course and loved it. I think we took it together, right, Diane? So this is like highly prevalent. It is really out there. There's so much that we can do as health coaches. So question for you guys, how, as health coaches who cannot diagnose or treat an illness, how do we go about doing this? How do we say, hey, I'm going to help cure your autoimmune disease without going outside our scope of practice?
Yeah, I think, being very clear to use language like I do not diagnose and treat is really important right off the bat. And that's something that I do in my initial communications with clients. I do a free 10-minute chat just to see if we're a good fit together. And from there, it's good to see the client's expectations. If someone says, tell me about other people whose Hashimoto's has been cured, red flag, like, well, I don't actually work specifically with Hashimoto's. I can't treat your disease, but I can work with you to identify food allergies and sensitivities. We can work on restoring nutrient density, supporting gut health, and I can help you formulate some questions to advocate for yourself with your medical providers. And that conversation, I think, being really forthright from the beginning that, you are not going to be the medical provider unless you are licensed and able to give that advice or run those tests, but that you're going to expect them to go to their medical provider or have a partnership with a medical provider that can do that for them. And for people that come to me with very complex situations, I always ask, who are you working for to follow up with your Crohn's disease, for example, your multiple sclerosis? It's a really big red flag when they come in and they say, I'm done with conventional medicine and I don't have any support. Then I know that they're going to be relying on me for information that I legally can't really provide. And so having said that, I think that there is kind of a movement within health coaches that we have all of this information at our fingertips, and we really want to be able to help our clients in a way that we're not really set up and educated to help them with. Instead of going down that route, really think about being that bridge, like Angie talked about, being between them and the medical provider and helping them fulfill that MVP, most valuable player. They are in the driver's seat. They're the one who gets to make all the decisions about their care. They're the ones that has to advocate with their providers. And they're the ones who we collaborate with in order to make dietary changes and so on and so forth. And when we give them the information, that provides them empowerment. They then have ownership over their own journey, and everything works better in that way. And so I think thinking of health coaching as kind of like unlocking their inner ability to really guide their own process, instead of being, you know, a very allopathic conventional medicine view is like, I am the expert and I will tell you what to do. Don't have that vibe. Have more of a, you know, bringing out their inner guidance there. So I don't know if that's helpful.
It absolutely is helpful, because we get the question all the time, even just forget autoimmunity, but just in general, how am I supposed to health coach? How can I help someone with their health if I'm not allowed to do this, and oh my God, I'm in a red state and all the rest. So
you can notice things. If you know about SIBO, I mean, it doesn't mean you can't talk about SIBO. You can say, hey, all of these symptoms, they sound like SIBO. I can't diagnose that, but here's some questions to ask your provider. Here's some tests to ask your provider. There's nothing wrong with that. And actually, that's how a lot of our clients have advocated for very specific things. I mean, Angie has a client that actually, she has discovered that they've had endometriosis, they have uncovered cancer, just because of her thinking, you know what, this does not seem like X, Y, or Z. You should ask your providers for some more testing. And that detective work is absolutely within our scope to then refer them to go ask questions to their medical providers.
Right.
Okay, there's something to pocket right there, you guys, the I notice idea. Go ahead.
Yeah, I was just going to say that, you know, what I would add to what Mickey's saying, of course, I agree with everything she just shared. I would also say, you know, I don't think of the autoimmune protocol as being a method for curing autoimmune disease. First of all, we should have really careful ethics, especially when we're working with autoimmune clients, around words like cure and remission. It's really tricky, and they should really understand from the start that cure is not realistic with autoimmune disease. Once the body learns how to have those antibodies, it will not unlearn it. But a better word might be, rather than treat, something like manage. And management includes having like a set of skills, a toolbox full of skills that can help them manage this disease over the, you know, course of their life in a way that gives them the best quality of life. And I think of myself more like helping them build skills. You know, it's like really a deep skill building process. And part of those skills being how to best utilize their time with their medical providers. Like, what kind of information can I share with them to help them get high mileage out of every appointment and really make that relationship work to its ultimate. In the end, a health coach should function in a way that relieves stress from the provider and the patient.
I like that image. That makes every doctor want to work with us, right? Well, sometimes not, but sometimes you really can form a working relationship or have that communication. I know you talk about that during the course.
Yeah, definitely. I mean, that having the opportunity to be part of the medical study process, you know, I got a chance to have a close relationship with a gastroenterologist and with a primary care provider who helped us with the Hashimoto study. And in both of those settings, it was great to see this really positive way that we could communicate and show each other how we could best support the patient.
Well, I know everybody is interested in learning more about what you guys offer. When is the next enrollment for AIP Certified Coach, and where should everybody go to learn more?
So we are actually enrolling starting tomorrow for our spring class. Yeah, I know, very timely. And we will be taking enrollment until February 23rd, or until the class fills. Our class usually fills. So if you guys want to join us, we recommend signing up maybe in the first few days. And then we will have class from the very end of this month to the middle of April. And then we'll be running it again in the fall. So if the timing doesn't work for you guys, you can get on our interest list. The website's aipcertified.com, and we would love to have you.
Jennifer says she's on the wait list and she already bought the books. All right. Thanks for being here today, you guys. I really appreciate it. Thanks for joining us, everyone. This is an important topic to learn more about. Everyone can check out aipcertified.com for more info on becoming certified as an AIP coach. And if you are newer to coaching and looking to get your business off the ground, remember you can join my free meetup that's happening on February 16th by registering at healthcoachpower.com/getstarted2022. And we'll see you next week. Thanks again for being here today.
Thanks, Michelle.
Bye, guys.
Bye-bye.